Every year at Logifam, we have a Christmas party, and this is a really wonderful, slightly chaotic event. We invite the women who've been in our organisation that current year and also the women who've been in our organisation in previous years. So it's a really good opportunity to see what has happened to women after they leave Logifam. Some of them are doing really well and thriving in housing, and others are still in very precarious and fragile situations. So as a manager, one of the things that I'm always thinking about after the Christmas party is, are there things that we could do differently as women transition out the shelter that would help them to find more stability after Logifam? I looked for different data sets and research to try and find out if there was any information about the kind of supports that can really help a woman transition out of a shelter. But I couldn't find research that really reflected our population, which is very broad. We have women with children and women without children. We have women who are experiencing homelessness because of conjugal violence and women who are experiencing chronic homelessness. We have women with mental health issues and women from many different ethnic backgrounds, and the women are aged from 18 to 65. It's a really diverse population with many different factors that have led to the woman needing to be in a shelter in the first place. So I wanted to find out more about that transition. I applied for a grant with the Canadian Observatory on Homelessness to get a free evaluation service. We didn't win that grant, but we did get to have a free consultation with them. And they put us in touch with a professor at McGill University who put us in touch with another professor, Laurence, who also happened to be the supervisor for our occupational therapy interns that semester. So Laurence and I sat down over coffee and talked about what kind of research project we could do at Logifam that would help us really understand the transition of a woman from a shelter into permanent housing. Laurence and I put together some funding applications to get a research project funded. We were unsuccessful on 2 rounds of funding applications, but the third time we got lucky and we got a year's funding from the Catherine Donnelly Foundation to do a community-based participatory research project on women transitioning from shelter to housing.
So as an occupational therapist with experience working in a hospital, on physical medicine units, in inpatient psychiatry, and from time to time in the ER, part of my role is to assess if patients are safe to be discharged home, and if so, what resources are needed. Now, for any individual that ends up in the hospital due to a physical medical challenge, a mental health or substance use issue, difficulties in the social domain, or any combination of these, their admission and stay is often the result when things have gotten especially difficult for them. What I noted working clinically is that the discharge of individuals with no fixed address or without a stable home to return to is often much more difficult and can result in a longer hospital stay, which has its own set of problems. So when I met Laurence through my PhD path, and she knew my interest was in the stream of holistic health and the challenges OTs find in discharge planning, she told me about her research in homelessness and a bit about Logifam, Sally, the idea of the project, and I was sold in terms of becoming involved as a researcher. Now, one of the things I love about this project is it is community-based. And it's action research. What that means is it focuses on engaging the individuals that are affected, and it has an overarching goal of working towards a more socially just and equitable health system. So while there's a whole conceptual model of community-based participatory research, or also called CBPR, what we want to highlight here today is the process. That is, that it includes all stakeholders. Meaning, we give equal value to the voice of all types of knowledge, including lived experience, including frontline workers in the community, as well as managers and researchers. And we really seek to build sustainable partnerships, to be able to transfer the knowledge that we've gathered and build individual and agency capacity. One way to think about this is thinking about not about us without us. So one of the first steps we took for our CBPR project was the creation of a cross-sectoral advisory board to govern this process and the project development. And through our networks, we recruited 8 more members, including 3 Montreal-based resources who work with homeless women with or without children, provide drop-in services, emergency shelter, transitional, and long-term housing. We also recruited 3 women who have experienced this transition from a shelter to permanent housing, an additional researcher, and an occupational therapist working in the community. So for our project, we're really using a broad definition of homelessness. That is, we include any type of housing precarity for women. So for example, the woman might have experienced chronic or episodic homelessness, or they may have become homeless due to conjugal violence. Specifically, our project is focused on women who have been in a shelter and have transitioned into permanent housing. So together with our advisory board, we've been involved in 4 interconnected project phases. Phase 1 was a scoping review. Based on the scientific literature, we looked at what summarizes the outcomes and experience of women who have transitioned out of sheltered living. Phase 2 was photo voice interviews with women who had exited a shelter and moved into an apartment in the last 12 months. Now, during these interviews, the women would talk about their experiences using photos they took to explain what helped or hindered them. Phase 3 was a virtual World Cafe event that brought these preliminary project findings to a broader community for deeper discussion. And Phase 4 is the identification and adoption of actions to go forward with that support women in their housing transition.
One of the first activities we did with our advisory committee was a reflective activity to think through what the transition from a shelter to housing meant for the different members of the committee. We invited everybody to look at these 9 images and to choose an image that spoke to them about that transition. The activity also introduced the committee to the photo voice process, which was a key tool in the research project. One of the committee members chose this photo of a young girl beaming under an umbrella, reaching out her hand to catch raindrops. This spoke to her about the joy of new beginnings. She also pointed out that both the umbrella and housing offer protection to allow people to continue to do well even when conditions are difficult. Someone else used this photograph of a butterfly emerging from a cocoon to talk about the transformation process when a woman leaves a shelter to move to the next phase of her life. This process is beautiful and exciting, but it can also be a challenging time of struggle and fragility. We talked about the fact that housing is not the solution to all problems and that indeed new problems may emerge when a woman is housed. This photo of an empty fridge with only a pepper on the shelves spoke to one of our members about the food insecurity many women experience when they're housed but have very limited income. The need for social connection came up in our discussions. This photo of 2 women drinking tea together spoke to one of our members about the importance of meaningful relationships once a woman is housed, and also reminded her that it can be difficult for women to maintain connection when they've been through a lot of transition. Many women experience isolation when they are housed. Having lived in a community living setting in a shelter, the transition to housing can be very lonely. This photo of a woman lying on a bed looking up at the ceiling spoke to one of our members about the anxiety and depression loneliness causes. We also talked about the issue of security in housing. This image of a broken hinge reminded us that even once housed, many women are still in unsafe situations and are vulnerable to different kinds of abuse. This was one of the most powerful images that was chosen, and the person who chose it talked about how, as you leave a shelter, the first few steps can seem very solid and very clear, but the pathway forwards is still quite scary, and there's this fear that at some point the stable pathway is going to end and the woman's going to find herself in a precarious situation again.
So conducting the photo voice interviews gave us access to very rich and descriptive information on the processes and experiences of women during their transition from shelter to home. We had a very diverse group of women ranging in ages from 28 to 65. Some had dependent children, and some had kids who were older and independent. And some had either lost touch or custody of their children or given them up for adoption. The women had various relationship status of either being in a couple, single, widowed, and most, but not all, were heterosexual. In terms of cultural backgrounds, we had English and French-speaking participants with varied ethnic backgrounds. We had women with medical issues, such as visual impairment or severe arthritis and chronic pain, to the point of having to use a walker and adapted transport to get around in the community. Some of our population also deals with past trauma, mental health issues, and struggle with substance use. So even though the backgrounds were very diverse, what they reported was quite similar in terms of what helped them and what they would recommend for this transition. For example, this woman was speaking about the need for help with practical things when adjusting to a new country, when learning a new language or two, as well as living on one's own with children for the first time. She states, "After the hospital, and I come to live at the shelter. And I met some other ladies and still have, and they need to study. They need to know how to live a life here." Another category was the need for individualized support. This woman was reflecting on her social isolation and her lack of support. And in referring to the importance of her cat, she told me, "He is my baby. He is really the only person I have left in my life. And I would like to have somebody to talk to, somebody to go out with." Another category points to an area that could be addressed by peer support strategies. This woman stated, "I would love to get a workshop for the people coming from homelessness. Once they can get back on their feet so they can move forward, they will move faster because that will inspire them to share their stories." And one of our participants, who is legally blind and a mother, asked me to find a picture of a community center for her, as it was too difficult for her to go take photos when not in her home. In this case, she was talking about the importance of group activities. And she told me, "It's important for us to have a place to meet other mothers and to see that it's not just us with these problems, and even to have a place for the kids to do some arts and crafts. That would take all of the stress of the kid off the mother, and to have support for the mother. So that's what I think. So just have a place like that."
Once we had initial findings from the literature review and from the photo voice interviews, we wanted to take those to a broader audience, so we organised a virtual World Cafe. We had 36 participants representing different key stakeholder groups, so representatives from healthcare and social services, from community organisations, from Montreal-based coalitions, and we had 8 women with lived experience of homelessness, and we also had 8 researchers. During the World Cafe, those participants were split into groups, and each group had participants from a different stakeholder group, so there would be a variety of perspectives for the discussion. The themes that we addressed in the World Cafe were the 4 themes that came out of the photo voice interviews. So we had practical support, peer supports, individualized support, and group activities. Each theme was approached by a group using 4 different angles. The first question we asked participants was what already exists in terms of supports in Montreal. The second question was about personal experience and storytelling. The third angle was about the new things that could be done, and the fourth angle was the priorities for action. We used a tool called Miro to build boards virtually on the computer screens. So the facilitators would take one group, they would all approach the theme from one of the angles. The second group would come, see what the first group had done, and then build their ideas on top of that with the second theme, and so on and so on. So we got these huge displays with lots of different angles and perspectives coming from the different participants. After the World Cafe, we held booster sessions with other stakeholders that couldn't participate in the World Cafe, but who we felt really had to have a voice in this project. And then we took the results from the World Cafe and from those booster sessions back to the advisory board, and we started to build logic models. For the logic models, we started off thinking about which activities could be done for each of the key themes. Then we talked about the inputs that would be required to do those activities, the outputs that the activities would create, and lastly, but most importantly, we looked at the results. So what were we really trying to achieve by that activity? So we built these complex logic models, and it was a similar process to the World Cafe, where the advisory board started building the logic models. Then we took them to representatives who'd been at the World Cafe to build in more information. And then Carla, Laurence, and myself finalized the boards. And while we were doing that, we also identified risks and obstacles to the activities being successful. We had a lot of ideas for activities that came out, and it would have been really fun to be able to do all of them, but we needed to prioritize because we didn't have time and funding to be able to implement everything immediately. So first of all, we started to think about, of all the activities generated, which ones would have the greatest impact in terms of helping women to achieve stability after a shelter stay. Then we talked through which would be the most difficult to implement, either because they would take time to set up or because they would require significant funding or maybe resources that are scarce in a community sector. We eliminated the activities that would have low impact and decided to focus initially on the activities that would be relatively easy to implement but that would have high impact. And we scheduled for future priorities the activities that would take more resources to implement but would also have a high impact. So the first two priorities for action that were identified were a relocation guide and a needs assessment tool. The relocation guide is designed to be a tool that is owned by the woman leaving the shelter. And it's basically like an interactive workbook that she would use to help her think through all the different phases of her move. So the idea is that she would be able to get information in the book and also make notes in it that would be relevant to her. It would cover things like preparing for a move, identifying furniture, how to get her name on social housing lists. It would have themes on how to take care of herself during the move, and then also how to orient herself in her new neighborhood and how to find the kind of services that she needs. And it would also serve as a tool for the intervention worker to ensure that she was helping the woman to think through each phase of her move. The needs assessment tool was more to be used by an intervention worker to help her evaluate what kind of needs the woman might have as she transitions out of a shelter, to make sure that the support offered would be really relevant to the needs of that particular woman, and that any particular risks that a woman might face would be addressed. The Lotus Project has been really cool to work on. It's been so rich to be able to exchange with different participants coming from different perspectives, and to bring an activity or an idea to a group and to immediately be able to get a response from what that looks like from a research perspective, from a community organization perspective, and also most importantly from a woman who has experienced that transition, their perspective. I've really loved working on it, and it's also been cool to see the kind of other projects that have been born out of it. So we, at the moment, have a group of occupational therapy students that are working on a food security project coming out of the Lotus Project. And we formed a community of practice out of this project too. But the coolest thing about it has definitely been hearing the experience of the women who've successfully made that transition from a shelter into permanent housing. And so I think it's fitting that we end the presentation with a word from one of those women.
I recently turned 44 years old. I'm a mother of a 6-year-old daughter. After the birth of my child, I suffer from a severe postpartum depression with chronic anxiety. I was hospitalized for 11 months, and while I was there, my relationship ended. With the help of the hospital staff, I found a place at WH3.1 for a year. Now, I have my own apartment in a social housing project with a playground at the door for my daughter. I got involved with the Lotus Project because it's not another attempt to create a quick fix, and the women's voices are included. It's a chance to be part of something bigger than me, for something good to come out of that terrible time in my life. A way to pay it forward. For the first time, I feel empowered. I can see myself going back to the working community, maybe as a peer support worker. I sincerely hope that the Lotus Project will be able to continue.
We would like to thank Dr. Laurence Roy and the Supervisory Committee at McGill for their academic guidance and support. We wish to thank all members of the Advisory Committee and all participants in the research project so far and in the future. And we'd also like to thank the Catherine Donnelly Foundation for funding this project. The lotus represents the power of every human to flourish, no matter what the conditions of life or the difficulties encountered. For more information about the Lotus Project, please contact Carla Jacobson, carla.jacobson@mail.mcgill.ca, or Sally Richmond, sally@logifam.org.